Vinaka, and welcome to another episode of Health Talk with Oceania Hospitals. I'm your host, Alex Avilati. A massive thank you to everyone who have been following the page and also our YouTube channel for the support and likes. Thank you very much, Vinaka Makaleva. Today with us in studio, we have our pediatrician here at Oceania Hospitals, Dr. Aryan. Doc, and welcome to the show. How are you?
Nisabura Vinaka, I'm good, sir. Thank you very much for inviting me to your show.
Thank you, Doc. Just before we start, could you kindly just introduce yourself, just a brief history of your background that eventually led you here to Oceania Hospitals?
My name is Madhav Aryan. I'm a medical graduate from India, and I subsequently did my post-graduation in Pediatrics and Neonatology from India. I've served in the Indian Air Force for about 16 years. Subsequently, I worked in the Middle East, I worked in Europe, and I worked in Africa. And I first visited this lovely islands of Fiji, in 2020 during COVID time. And initially I was working with the government hospital at Lambasa. Then I relocated to Oceania Hospitals. I briefly stepped away because I had some domestic commitments, and I'm back here once again. And I can assure you guys that I've been all over the world, but this is one of the most beautiful places to be in.
Thank you. It's quite interesting. Just jumping into pediatrics, could you just just describe about pediatrics in general?
So pediatrics, we deal with children who are less than 18 years of age, and it starts from the time they are born to the time they complete their adolescence. But in Fiji, it's slightly more restricted. We stop seeing pediatric patients around the age of 13, and they transition on to the adult physicians. So here in this hospital right now, the scope of pediatrics, we are not including cancer or oncology treatment, and we are not including burns treatment, and we are not doing poisonings. But we assure you that in the recent future or in the near future, we hope to introduce these services. Short of that, we provide all other services here.
Thank you. Doc, just speaking of services, could you let's just dive into the services that's provided here at Oceania Hospitals.
So at the present moment, we are providing outpatient care only because we are upgrading into inpatient facilities. We are in the process of a massive recruitment drive. So we will be recruiting talented doctors both from India and overseas. We have some people already on board. We are getting specifically trained pediatric nurses from within our country, and we are also looking without. So we expect this entire process to be over in the next 8 to 10 weeks. The equipment is here, the medications are there, the enthusiasm is there, and we have got 100% support from the management in this. And I'm very happy to say that we will be rolling out state-of-art pediatric services soon. As of now, we run unlimited birthing services. Babies who are born here, who are healthy, we do admit them and we look after them. But babies who need some kind of supervised care or critical care, at the present moment, we are referring them out to CWMH, which is across our friends, and they have been very nice. They've been obliging us thus far.
Thank you, Doc. You just mentioned about being a huge recruitment drive, and could you just tell us where can we see pediatrics, especially with your expertise here, within the next few months or year?
So our plan is that we are starting small to be safe, and we do expect there will be some small routine hiccups whenever we start up a new center. We would like to perfect ourselves before we go on to the next stage. But the long-term plans, as I'm given to understand, is that we plan to open up a pediatric center of excellence here, and that need not necessarily be limited to the population of Fiji, but we expect to roll out these services for even other Pacific islands. And maybe a couple of years later, we expect to see some patients coming in from New Zealand and Australia as well. So that is the scope of our ambition, to keep growing and to provide the best services possible.
That's quite an interesting journey, especially with you being a HOD for this department. Just from your point of view, what is the stance of pediatrics, especially in the healthcare sector here in the country?
So we do have established pediatric services here, and most of it is provided by the government services at Lambasa, at Lautoka, and at Suva itself. These are the major centers. And then of course you have smaller healthcare centers across. So if you ask me, I would say that we do have fairly decent pediatric services. However, there's always a need for more. So we expect to get into those gaps and fill in those places where we have certain shortfall, especially in subspecialties. We do not have, say for example, a hormone or an endocrine specialist. We do not have a pediatric oncologist. We do not have a subspecialty care yet. But we do have our own doctors here, our own citizen-trained doctors who are doing a very good job at it. But at some point of time, we would like to make this as a more permanent thing, rather than see our patients seek medical tourism and step out to other countries for more specialized care. And this is where we expect to bridge those gaps.
Just before we wrap up, Doc, do you have any advice or tips, especially for our patients out there, parents especially?
So to the parents, I would say that we are in the midst of a flu season. We are in the midst of a gastroenteritis, or what you call as a diarrhea season in layman terms. And we are also having a lot of cases of dengue. So I would request you that mosquito-proof your houses, make sure there are no stagnant pools of water, and inform the health authorities if there is a patient or a case within your midst. Avoid eating out. Always make sure you take home food prepared hygienically. Make sure you drink boiled and clean water, and stay away from all sick people. Basically, the sentence is stay healthy, stay safe.
So we're just gonna go off topic. Most of our kids now have access to social media, especially within that age range that that's considered pediatrics. They could be watching right now with their parents. Do you have any advice for them?
So social media is not necessarily the best thing around available, and there has been a lot of debate on social media. There are now countries which are restricting social media usage to children, and including some of our neighboring countries as well. So I think that's a good step forward. But what I would suggest is that if the child has to be exposed to any kind of a digital screen, it should not be more than an hour on a weekday and not more than 2 hours on a weekend. Anything more is not helpful, and there should be no exposure to any lighted or any LED screen for 1 to 2 hours prior to bedtime.
Thank you very much, Doc. Well, there you have it, ladies and gentlemen. So from us here at Hot Talk with Oceania Hospitals, we'll see you next week. Good night.